In the rugged landscapes of the Old West, where legends were born and outlaws roamed, there existed a time when even the bravest souls quivered in fear at the thought of a visit to the local dentist. In this narration, we delve into the grim and harrowing history of dentistry during the frontier days, a time when toothaches were agonizing, extractions were horrifying, and the tools of the trade could only be described as barbaric. Join us as we journey back to an era when dental care was in the hands of blacksmiths and barbers, and the mere sight of the dentist's chair struck terror into the hearts of many. This is the untold story of dental woes in the Wild West, a tale that makes us truly grateful for the progress we've made. But before we move further, please subscribe our channel and like the video. Often I hear folks yearning to have lived in the good old days. To that, I usually retort, the good old days weren't really all that good. Recently, Professor Joanna Bourke aptly stated, "Agonizing toothache, horrifying extractions, and barbaric tools have cast a large shadow over our dental past." Truer words were never spoken. Trained dentists didn't come into existence until the 1800s. Prior to that, the responsibility for the nation's oral health fell upon blacksmiths and barbers who, interestingly enough, also moonlighted as surgeons. Their tools seemed like they were straight out of the Spanish Inquisition. Pliers for yanking teeth, or contraptions resembling bottle openers that relied on the poor patient's jaw for leverage. It wasn't unusual for them to accidentally unhinge the patient's jaw during these procedures. For centuries, this profession was a back-alley nightmare run by clumsy amateurs who left their patients writhing in agony, assuming they survived the ordeal. The influx of affordable sugar from the West Indies in the mid-1600s led to a skyrocketing number of tooth decay cases. Until the middle of the 19th century, tooth extraction was practically the only treatment available for toothaches, and it was a dreadful prospect. Countless people perished due to botched treatments, infections, and other complications, so it's no wonder that the dentist's chair was met with sheer terror. In the 18th century, transplanting teeth from the deceased to the living was in vogue for a time. Grave robbers would flock to battlefields to extract teeth from the deceased and sell them for transplantation. If you were fortunate, a shot of whiskey might numb the pain, but otherwise, all you got was a prayer. Until relatively recently, rotting and neglected teeth were an everyday ordeal. The invention of the mass-produced toothbrush in 1780 helped, but it was too pricey for the impoverished and was often shared as a community toothbrush. The dental drill emerged during the Victorian era. Operated by a foot pedal and a belt that spun the drill, the process was sluggish, but it occasionally allowed dentists to remove decayed portions, sparing the painful extraction. Out in the Wild West, dentists had to contend with irritable gunfighters. The outlaw Clayalison, suffering from a toothache, paid a visit to a dentist in Cheyenne, Wyoming. This dentist began drilling the wrong tooth. After having his troublesome tooth tended to by a different doctor, Allison returned to the offending dentist, pinned him down, and extracted a tooth with a pair of pliers. There was a solution available for some time, but it took nearly a century before it became a common pain relief method. The initial chemical used for pain alleviation was nitrous oxide, also known as laughing gas, invented in 1799 by English chemist Joseph Priestley. It gained popularity among the upper class for laughing gas parties, where everyone got high. Some believed it induced profound spiritual and mystical experiences, with one individual even claiming it revealed to him the secrets of the universe. Regrettably, these revelations quickly faded as the effects wore off. Its use for surgery and dentistry, owing to its anesthetic and analgesic properties, began in 1844. However, the equipment to produce sufficient gas for medical purposes and reluctance among doctors and physicians to embrace it delayed its widespread adoption until the 1870s. In 1876, Joseph Clover devised the gas ether inhaler, and it became customary to commence all anesthetic treatments with a mild dose of nitrous oxide, gradually transitioning to stronger ether or chloroform. This practice continued until the 1930s. Modern hospitals now employ more advanced anesthetic machines that still adhere to the same principle initiated by Clover's invention, commencing anesthesia with nitrous oxide before administering a more potent anesthetic. In the early 20th century, dentistry remained so costly that some individuals chose to have all their teeth extracted to spare themselves a lifetime of agony. Having all your teeth removed was seen as the perfect gift for a 21st birthday or a newlywed bride. Thankfully, we can now appreciate the progress we've made.